Good afternoon, and welcome to the April 16th Community Update. My name is Stacy Wood, and I serve as a Public Information Officer in the Emergency Operations Center. As a reminder, this Community Update is also available in Spanish on the Buncombe County Health and Human Services Facebook page, which can be found on Facebook at BCHHS. Today's updates come from Dr. Jennifer Mullendor, Buncombe County Medical Director and Interim Public Health Director, Fletch Tove, Buncombe County Health and Human Services Public Health Preparedness Director, and Taylor Jones, Buncombe County Emergency Services Director. We will get started with an update from Dr. Mullendor.
Good afternoon. As of noon today, there have been 43 lab-confirmed cases of COVID-19 in Buncombe County residents. 44% of those individuals have been between 25 and 49 years of age. There remain 3 COVID-19 associated deaths in Buncombe County residents. Mission Hospital continues to not see an increase in patient volumes. Our stay home, stay safe efforts are working. We know that the restrictions on businesses, schools, and the general public are having a significant impact, financially and emotionally, on individuals, families, employers, and our community as a whole. Yesterday, Governor Cooper and Secretary Cohen of the North Carolina Department of Health and Human Services outlined 3 areas in which progress must be made before these restrictions can be gradually eased. 1 was testing for COVID-19. 2, identifying and interviewing the close contacts of individuals with COVID-19. And 3, following data and trends that show how COVID-19 is impacting our state and county. So first, let me address testing. We know and have known for some time that more testing is needed. The message at the federal level has been that there are plenty of tests to go around. However, what we have seen at the state and local level is that tests have not been readily available to conduct widespread testing of the community. The availability of testing continues to improve through commercial labs so that there is now more availability than there was last week. And we expect this progress to continue. Results for these tests are returning more quickly, thanks to streamlining of processes by labs. At the local health department level, we continue to have access to tests through the State Lab of Public Health. This testing is focused on high priority groups, residents and staff of congregate living facilities like nursing homes, homeless shelters, or jails, first responders, and healthcare providers. Local medical providers are conducting testing as their ability to maintain personal protective equipment and institute infection control measures is sufficient. However, even with the expansion of testing options, there remain issues with insufficient supplies of the chemicals used for testing. And some of the testing equipment that is being promoted to healthcare providers is of insufficient quality, meaning that the results may not be valid. Buncombe County is looking at how we can improve the availability of testing for COVID-19 in our community. We are following up with local, state, and national lab companies and working with local healthcare providers and other partners to explore opportunities to bring more testing to the county. The second focus is on contact tracing. Contact tracing is a basic public health practice of identifying and interviewing the close contacts of individuals with COVID-19, assessing them for symptoms of illness, connecting them to testing if indicated, and isolating them from others to prevent the further spread of illness. Since the beginning of this outbreak, Buncombe County communicable disease nurses have been conducting contact tracing for all of our cases. While they are currently able to handle the load, we have identified and will be training additional staff to support these efforts, as we expect to identify more cases when testing increases. Finally, data and trends. In order to ease restrictions, we need to understand how COVID-19 is impacting our community. Data and trends that the state and our county will be following include things like the number of cases, the number of people being hospitalized for COVID-19, the number of deaths, as well as the supply of personal protective equipment and the capacity of our hospitals to take on new patients. We are preparing for and responding to the need to ensure that testing, contact tracing, and access to accurate data is available. We wish we had a quick fix and tomorrow could offer testing to everyone in our community who needed it, but that is not the reality in which we live. I am hopeful and expect that with every passing week, we will get closer toward making testing available for everyone in our community who needs it. But I wanted to be real with you today about what we are currently able to do. At this time, if you are sick with symptoms of COVID-19, so fever, cough, shortness of breath, please contact your primary care provider or a local urgent care. If you don't have a primary care provider, you can call us at Buncombe County at 828-250-5300 to speak with a nurse who can assess your need to be tested. Please continue to wash your hands. Avoid touching your face. Wear a face covering when you go out in public if you can't maintain physical distancing from others. Take the stay home, stay safe order seriously. Your actions matter. What all of us in our community are doing is working, and we will get through this challenge because of these actions. Thank you.
Good afternoon. I'm Fletch Tove, Buncombe County Public Health Emergency Preparedness Director. Yesterday, Governor Cooper shared his roadmap to a new normal. The state's three-pronged strategy, which Dr. Mullendor just spoke on, focuses on testing, tracing, and trends. Earlier this afternoon, our Buncombe County Commissioners approved a resolution which supports Buncombe County efforts to expand community testing and contact tracing for COVID-19. This local resolution, alongside the governor's roadmap, chart a path forward for Buncombe County as we continue to develop our strategies to slowly reopen our community and our economy. The proactive steps Buncombe County has taken over the last several months have been effective in safeguarding our community so far. I'd like to take a moment and give a brief timeline of what those steps have been. Public Health began its messaging and education campaigns for COVID-19, then only known as a novel coronavirus, on February 5th. On March 3rd, we moved our epidemiology team into a weekly operational cycle. On March 9th, Public Health formally established a joint information center. On March 12th, the county declared a local state of emergency. The following day, March 13th, Buncombe County and the city of Asheville came together in a remarkable manner to stand up our Emergency Operations Center. On March 19th, we began implementing local restrictions, and on March 25th, we issued the first iteration of our Stay Home, Stay Safe order. Since standing up the Emergency Operations Center, we've also supported city and county schools in delivering 480,000 meals to our school children, establishing isolation and quarantine housing solutions, establishing our Ready Team call center, and establishing a homeless shelter at Harrah's Cherokee Center. In all that time, our county communicable disease nurses have been working tirelessly and relentlessly to test and trace cases of COVID-19 and protect all of us. COVID-19 has had an unprecedented impact on our community and on our individual lives. But Buncombe County's response has also been unprecedented to match it. As we look ahead and strategize how we can slowly start to reopen our community, the Emergency Operations Center is working aggressively to increase our local testing capacity, to expand our contract tracing capabilities, and to establish standards and triggers for data trends and leading indicators of how our response is working. We need these things in place before we can start easing restrictions. The process of easing restrictions will be slow and gradual. Think of slowly opening up a faucet. We can slowly ease restrictions for the community, for retail, for restaurants, but if our data and leading indicators show us that we are seeing a surge of cases, we, as a community, will have to be prepared to re-implement these restrictions very quickly for a period of time. This process of slowly opening the faucet and then quickly closing it and then slowly starting to open it again will go on well into next year until we have an effective vaccine. This is the new normal that Governor Cooper was referring to yesterday. Everyone needs to mentally start preparing themselves for this long-term dance with COVID-19. We are in the early stages of a marathon, not a sprint. While we are looking to plan for the future, we must remain vigilant and steadfast in our current efforts. Now is not the time to relax measures and not the time to not take these measures seriously. We still risk overwhelming our healthcare systems and our ability to come through this as a stronger community. We still expect our initial spike of cases to be coming in the near future. And we need to learn from the examples of other cities who have opened up too soon or too quickly and have had to resort to drastic measures to curb a second peak of cases. Buncombe County government will continue to make decisions that are best for the residents of Buncombe County. Our decision-making process will be guided by the best available data and science and the best available models. This means that we can't predict with a strong degree of certainty when we can start easing these restrictions, but rather, we must evaluate and assess numbers and trends on a daily basis and act accordingly. Our primary goal is to safeguard the public health. And another goal of ours is reopening our community and our economy as soon as that makes sense. And I want to assure everyone that we are working diligently and hard every day to achieve both these goals. Thank you.
Good afternoon. I'm Taylor Jones, Director of Emergency Services for Buncombe County. We have engaged with our partners in the Emergency Operations Center for 34 days now. During that time, I've seen some amazing work with strong collaboration between our EOC team that is made up of our community preparedness partners, that includes our municipalities, our state and federal partners, our faith-based groups, and our nonprofits. Our EOC team has been very active in supporting the community-wide efforts. These efforts have been inclusive of coordinating and establishing special medical needs shelters, planning for alternate care facilities at both the University of North Carolina at Asheville and at the AB Tech Allied Health site. These are pre-positioned for the need if the need arises. These facilities have been inspected by the Office of the State Fire Marshal, by the Office of the Emergency Medical Services, and with operational plans reviewed by the Army Corps of Engineers. Our state medical assistance team has trucked in trailers of pre-positioned medical supplies that is co-located there at the AB Tech Nursing Care Simulation Lab. This was an ingenious idea that AB Tech brought to us in the Emergency Operations Center to set up a functional nursing skill lab as an alternate care facility. And then using the assets from our state medical assistance team to set up that type of surge capacity with all the medical supplies that will be needed for this region. We've been working with our partners at AB Tech also to build a EMS ambulance driver's course, which is the Emergency Medical Response 40-hour training course. In case we experience the work reduction that we've seen some of the other EMS agencies experience in big cities across our nation. We hope that we never need this, but we've been amazed by our county employees stepping up and taking this 40 hours of training, and the AB Tech instructors doing such a great job in providing them with this training. This is also training that we may use another date, and it's been very valuable for our Buncombe County employees. We have developed additional EOC plans that has focused on pandemic planning for our detention center, for our homeless population, for an outbreak in our long-term care facilities. We've done point of care planning for care test sites in case we get more capabilities to do on-site testing. We've been working with our fire, EMS, and law enforcement workers all across the board, all our public safety workers, to have a work reduction plan and have a plan if we have a decrease in workforce, how to step up and back each other up. We've been working with these plans with all our community partners, with our public health as the lead agency to perform these future operations. While we don't currently have a need for medical volunteers at the present, it should be noted that Buncombe County is working diligently with our partner agencies to develop a rapid medical volunteers credentialing process when that need should occur. As needs arise for medical volunteers, we will provide the community with more information on how to sign up and to serve. Currently, there is a need for non-medical volunteers, and these opportunities can currently be found at the United Way's Hands on Asheville, Buncombe County website. I would like to thank the State Emergency Management Director, Michael Sprayberry, and his team for the increase of flow of PPE to our healthcare providers in Buncombe County. We were able this week to put out 58,000 units of PPE to our healthcare facilities and healthcare workers. In addition, we'd like to thank our Emergency Operations Center partners, such as the Army National Guard, our city partners at the City of Asheville, Buncombe County school districts, the city school districts, for using their 3D printers to make PPE shields, our County Fire Chiefs Association for its incident management team, and the USAR, the Urban Search and Rescue teams, for all their heavy lifting over this very intense past week to get supplies and logistics out to our healthcare providers. While events such as COVID-19 pandemic put public safety and emergency services to the top of your mind, it should be remembered that there are all types of events that occur on an almost unpredictable basis. Those events include storms of the past weekend that caused severe flooding, tornadoes, and hail damage along North Carolina and South Carolina, caused loss of life. These are things that we should always be prepared for. We should make a plan for times of disaster. We should build an emergency kit, be informed, and have a family safety plan. This is a good thing to do while we're staying at home and staying safe. To find more about how to make a plan, go to buncombeready.org for information. Thank y'all.
In conclusion, we want the community to be aware of the need for additional supplies. The United Way of Asheville and Buncombe County is looking for personal protective equipment such as masks and gloves, cleaning supplies such as bleach wipes, and non-perishable food items such as canned foods with pop-top lids. Individuals or businesses with the ability to provide these supplies should visit the Hands on Asheville webpage. And that web address is handsonasheville.org, HANDSONASHEVILLE.org. Once there, click on the COVID-19 page and select the button that says, I'll give in-kind donations. We also want to make the community aware that data on COVID-19 cases is available on Buncombe County's COVID-19 webpage. This data is updated Monday through Friday at 1 p.m. If you have questions about the Stay Home, Stay Safe order or other questions related to COVID-19 in Buncombe County, you can email ready@buncombecounty.org, READY@buncombecounty.org, or you can call the Ready team at 828-419-0095. We will provide the next community update on Monday at 2:30 p.m. Have a safe and healthy weekend.